Hi.
Hello.
I am Lupita Garcia.
Nice to meet you. I'm Dr. Chang.
Good morning, señorita.
Why don't you have a seat? And how are you today?
Very well. I need to tell you that for the last 10 years I have dolor de barriga, pain here, here in my belly, and I have diarrhea. I have to go often to the bathroom, and it's liquid. And I am inflamada.
Okay. Can you explain a little bit more how that feels? Is that like you're not talking about pain? Are you talking about like a fullness or a pressure or?
I feel like pregnant.
You feel pregnant?
Like pregnant,
okay.
Yes.
Yeah, sometimes we use the term bloating for when somebody feels full, but it's not necessarily pain. And then when someone looks pregnant, so you can actually see it. Sometimes we call that distended, where it almost looks swollen.
Both.
And I think that's what we're trying to describe. Okay, so you have some pain, diarrhea, some fullness or bloating, and distension or looking pregnant. Okay, what else are you experiencing?
And you know that I came here 6 months ago, and since then I was feeling worse and worse, and that is why I'm here.
Okay, so you moved here from Mexico about 6 months ago, and how has that been for you, that change?
I suppose that is the food. I used to eat frijoles and tacos and beans, but now I only eat hamburgers and fries.
Yeah, that's good. That's what we offer in the United States. Sometimes food can obviously make people have symptoms, and their bowel symptoms can change according to diet. So I can see that the change in your food intake or your diet could affect your symptoms. Do you have any other thoughts about what your symptoms might be due to, or why did they get worse 6 months ago?
I don't know, but I think it could be maybe an amoeba. Amoeba, a parasite.
Like infection?
That is very common there in Mexico.
Okay. Were you ever treated for an infection before, for your symptoms?
Yes, sometimes I have a flagell.
The Flagyl, I think,
yes.
And an antibiotic?
Yes.
And what did that do?
It works, but then the diarrhea starts again.
Okay. Well, thank you for bringing in records. So you did have medical records, you did have some tests, and some of them were done in the United States before you came here. And there were some what we call stool studies when you would go to the bathroom, and we would check for an infection, and those were normal. So there was no evidence for infection. So I don't think that's what's causing your symptoms yet, but it's a valid concern.
And do you think it could be a family problem because my mother has the same problems, the same symptoms?
Yeah, there's probably a lot of different factors that can cause symptoms or impact or play a role in the symptoms, and sometimes there's conditions that run in families. So often someone else in the family will have a similar symptoms. So that's possible. Yeah, we see that a lot.
But I have confessed that I am very nervous because I think that this could be a cancer.
Well, I think that's a really valid concern, and I would feel the same way. Now, when I looked at your records, your tests, you did have studies to look for cancer in the intestine, because that can cause similar symptoms, but they were completely normal. There's no evidence of cancer. So I don't think that's the problem. Yeah, okay.
Gracias a Dios.
Well, what have you done for your symptoms to try to treat them?
Well, I get Imodium, Flagyl sometimes, and the curandero gave me some herbal medicine.
Okay, and that is that a type of physician, a doctor, or healthcare provider?
The curandero is like a doctor, but it's not a doctor.
Okay. A healer, or someone that you go to for some medical attention? Okay.
Yes.
And what did this?
He gave me herbal medicine.
And how did that relieve your symptoms? How did you do?
At the beginning, but then the symptoms start again, the diarrhea.
Okay. Well, we try to give a lot of different treatments for these, and some work and some don't. And sometimes we use a combination. So I think what we can do is we'll do the physical examination. We'll review your tests again and talk about what we think you might have, and then we can discuss what are some good treatment options for you, because I know that's affecting your life.
Yes, you have to help me because I have to work, I have to get money for my family, and it's difficult with the diarrhea.
No, I completely understand that. Okay, so let's do the physical, and then we'll talk again.
Okay? Thank you, señorita.
Great. So,
Oh yeah.
so let's give him a round of applause. Let's give him a round of applause. So, this time around, Dr. Chang, what were some improvements? What were some strategies we can glean from that? Yeah, they both improved, and it's possible that she improved, also kind of based on, again, changes that the doctor made. What were those changes, adjustments that the doctor made that we might be able to kind of glean?
She relates to her, she was more empathic, she
Good.
hears her and reacts to her.
Empathy seems to be a huge component. The simple act of listening seems to be tremendously helpful to set someone at ease. What else?
Well, there was a lot more of listening, but there was one thing I noticed, and maybe it's because it's 4 minutes of role play. The patient mentioned diarrhea 3 or 4 times, and I would have thought you might have explored incontinence because that could be a major issue. That might be really why this person is here.
Great, wonderful point. So listening for the symptoms that come up over and over, and what other symptoms do they lead us, or what questions might we ask as a result? There's someone in the back, and then we'll come back to you. Sure.
Another thing that Lynn did this time around was she clarified and used that to bring the conversation forward instead of putting up barriers, which she did the first time, and ended that discussion. She was able to keep moving.
Right, absolutely. Instead of shutting something down that she didn't agree with in terms of the Western model, is just kind of embracing it and bringing it into the conversation and adding to it. Wonderful.
I think there's an important point that Lynn may follow at the end of the consultation is beyond the food changes in the last 6 months. What else has changed? Kind of open question to understand what's. I think it's an important question to ask at one moment. I'm not sure it's right here or by the end of the consultation when you try to sum up what's beyond food. What else?
What else could be contributing? Yeah.
Yeah, I was struck by, I think, your summary statement at the end, kind of acknowledging the kind of pluralism of different treatments without judging it. I thought it was fantastic. You said, how did you put it? There are many different treatments that some people try, some help, some don't.
Or use a combination, some work, some don't.
Yeah, some work, some don't, right. Which I would imagine, some physicians, in their mind, they'd be saying, this stuff is not going to work. But if, in the moment, it doesn't make any, the person is doing the right thing and you have made a judgment that there's no iatrogenic effects. It's just a great way of kind of keeping it neutral.
Mm-hmm.
Absolutely. Absolutely. Any other strategies we want to glean? Good, let's give them one final round of applause on this one.